Hello friends, today is 29th October. It is celebrated as World Psoriasis Day all over the world. As psoriasis is a very common skin disease today. And we know that psoriasis is not a contagious skin disease. It's an autoimmune disease and it's a genetic disease. But it is not a recent disease. It has been there for thousands of years. Initially, before the development of science, that is the medical science, nobody knew what causes psoriasis. Even today, we know the pathophysiology of psoriasis, how psoriasis occurs, but we do not exactly know what causes psoriasis. Yes, when there were no treatments for psoriasis, 40 years ago or 50 years ago, there were psoriasis patients but very few. And according to textbooks, it was written in those days that psoriasis occurs in the third or fourth decade, that is at the age of 30 and 40 and above. And there were no treatments. It was managed by some quack remedies. But accidentally, a remedy was discovered, that is cyclosporine, which is an immunosuppressive drug, and that led to the research of psoriasis, that psoriasis is an autoimmune disorder. So that immunosuppressive drug was the treatment for psoriasis. Then some new drugs came, chemical drugs like methotrexate. But all these drugs only control psoriasis for some time. And even today, according to medical textbooks, there is no cure for psoriasis. It can only be treated for some time. But one has to live with the psoriasis throughout his life. Although recently they claim that medicines with less side effects has come up, but still one has to continue to take the medicines throughout the life. And even the less side effects are there, but there are no medicines without side effects. And today it has been found that psoriasis is common in the age group 18 to 25. And in my daily practice, I see even more and more patients, that is children, having psoriasis. One must know in this all history why the psoriasis is increasing in young adults as well as in children. Whereby, according to our science and medical researches, the medicines, our longevity of life has increased. We can live for longer time. But is our life healthy or is our life with psoriasis? Do you want this type of life? Definitely not. So what has led psoriasis to occur in lesser ages? One must know that psoriasis, although a genetic disorder, there are many people who do not have genetic tendency or genetic history, still they have psoriasis. Moreover, in the precipitation or occurrence of psoriasis, it has been found that it needs some trigger factors to occur psoriasis, to take psoriasis. And what are those trigger factors? Those trigger factors are environment, the bad diet, lack of exercise, lack of sleep, and the stress of modern life. So all these trigger factors contribute to the precipitation of psoriasis. And definitely that is one of the important factors that is causing psoriasis in young adults and children. Also, it is my experience and many of the doctors' experience that even if you are taking the medicines regularly, they may not result a good effect if you ignore all these diet, lifestyle, and stress which trigger the psoriasis or bad habits, smoking and alcohol. They will not help you to control the psoriasis. So, in controlling of psoriasis, along with the medications, these factors are important, and one must pay a good attention to that. Moreover, all these lifestyle changes and diet not only will help in the treatment of psoriasis, but all those who have a genetic tendency or who are prone to psoriasis, they can avoid or delay the occurrence of psoriasis for a very long period, or even they can avoid the psoriasis in their life. Moreover, one must note that not only the psoriasis, but there are other autoimmune disorders like diabetes, heart disorders, and even the cancers They do have importance in the lifestyle and diet that causes them. So all these disorders and all the treatment of psoriasis, one must have a role of your diet, exercise, and the lifestyle and the management of stress. So definitely on this psoriasis day, I emphatically say that if you improve your lifestyle, if you manage your stress, it will help you to avoid psoriasis, to control psoriasis, and to prevent psoriasis. Thank you.